Hello everyone, this is Dr. Bob Ranerick recording Upchemia Update number 6. These have been received really well, so I'll try to keep at this as long as you all find these are helpful. So unfortunate news is the coronavirus keeps spreading. You're seeing this exponential growth curve worldwide. Over 500,000 cases and close to 25,000 deaths. The rankings, there's a headline of U.S. having the most identified cases, although it's probably not actual. Some of these numbers are very much incomplete. The clue to that is just the widely varying case fatality rates. So you see Italy having a 10% case fatality rate. That's not true. What's happened is the health system is overwhelmed. They're doing the best to treat the people who need it most, and they're not working on identifying anymore. The true number is probably 3 to 5 times that. So the numbers in Italy are, I'm betting, probably in the 250 to 500,000 total actually, but that makes this falsely high. The other problem though is that literally Italy is at the point where people are not getting care, frankly, from lack of ventilators. And unfortunately, there may be secondary causes of deaths indirectly, because if you have a heart attack, a stroke, a car wreck, you're just not going to get care right now, and that could actually be adding to the whole problem. Although we also can see what is probably a more accurate number. I would say Germany is probably our most accurate numbers because they've done such a good job testing. They probably are identifying more of their cases, and that gives us closer to a true case fatality rate, hopefully in the 0.5-ish% range. So hopefully that's the case with Germany. So fortunately, at this point, we know kind of who our Philadelphias and our St. Louis's are. We know that Italy, Spain, and unfortunately maybe even New York is going to be the next Philadelphia. Our St. Louis's, the people doing this job are better. We know country-wise, it's Germany, South Korea, Japan, Singapore, Hong Kong, hopefully us in Nebraska as well. We'll find out here in the next few weeks. Some interesting updates. Johns Hopkins has been producing these visuals with a state level view, which I think is very interesting. The linear view is probably not accurate. The epidemics grow exponentially, so logarithmic scale is more accurate. And of course, giving you that version as well. What you see here is unfortunately New York and New Jersey affected the worst. Nebraska doing potentially the best, although I'd be a little cautious celebrating this because I think they've misidentified some or what our initial cases and these. I think these are the folks on the cruise ship who were shipped to our quarantine units who are not true index cases. It's probably over here, in which case we should slide this line back 5 days. Although still, if we do that, we are pretty close to number one, and so that is good news to hear that Nebraska is doing one of the best right now. So here we are, and the goal, of course, is to not overwhelm our health system and be more in this line, and I'm cautiously optimistic that this is where we might be. What we want to do is make sure that we don't have overwhelming of our health system or even an incomplete response. We want to stay below this line so that anybody who needs care gets care. This is the way to have the most people survive and make it out of this epidemic unscathed. It looks to me like the numbers on this mild case scenario are probably closer to right, although we really don't know yet. Still, the range of uncertainty is really wide, but if we can keep it in this range and over a nice duration, the paper in the newspaper said our largest hospital system had 114 ventilators. That means that we wouldn't exceed our capacity when you add the other hospital systems and whatever they could pull together. So if we can keep it in this range or better, we will not have so many deaths, whereas if we hit this area, we're talking thousands. So I'm cautiously optimistic we'll be on this side of things if we can keep it up. Other thing is credit needs to go where credit is due, and so I really credit James Lawler for being the first to sort of sound the alarm in Nebraska. This presentation was a month ago in Omaha. Basically, Dr. Lawler presented to the Omaha school superintendents, which obviously raised some eyebrows. People looked at this and thought, oh my gosh, what's going on here? And I will have to admit that my initial response was the typical denial response that no, this couldn't be true. But as I ran the numbers and checked them myself, I realized, oh no, I think he's right. So thanks for him for presenting this and having them forward this to Lincoln, because I think this was key in our rapid response side here in Lincoln. And so the fact that this was pushed through the University of Nebraska and the school systems closed early on, which I think they need to be praised for sticking their necks out politically and going ahead and closing despite some political opposition. So again, by keeping us here, I think we're hopefully set up better than everybody else. I think there's kind of three possible reasons. One, there are some side benefits of being sort of a flyover state. Our geographic isolation may have kept us later in the epidemic. Second, I think there is maybe some default social distancing in our culture versus the folks on the East Coast. On the East Coast, some of my relatives out there are the type that tend to hug and kiss when they say hi, like the Italians and Spaniards, where I think those in the Midwest are a little more reserved. So we have some default social social distancing, plus we tend to live more in detached single family homes and have more, just literally more space. But the third reason I think is truly the fact that we got on things pretty quickly and closing our school system may be why we are on the low end of this epidemic at this point. So those three factors together. So how do we get out of this mess? That's, I think, the next thing that is starting to be on people's minds. Again, early identification, early response is what you need to get out of this mess as well as prevent you from getting in. Unfortunately, we blew it in the United States by not doing this the last couple months like some other countries like South Korea and Germany. But to get out of this mess, we have to be at this stage as well. When I started graduate school at Johns Hopkins, our first intro to public health was the problem solving put together by the folks who rid the world of smallpox. This works, it's been tried and it's tested and it works. And so the problem I see what happened in the United States is we didn't one didn't even really recognize it was a problem. So for just like a 12-step program, the first step is admitting you have a problem. Then because of our delayed testing, we were unable to measure its magnitude. So the first two steps out of the gate led to some of our failures the last 2 months. I think we are going to have our measurement up and board online in the next couple of weeks, so I think we can start working at it. But to get us out of this problem, we also need a good communication strategy, and I think that's part of what's lacking right now too. There's still so much partisanship in this, and that there really are not turning to way things should be done. The public health epidemics playbook says the politician gets up and then turns it over to the experts, and that's not happening right now enough. Former CDC Director Tom Frieden has been writing a little bit about this and has put some good planning out there, and so I'd highly encourage you to read this article if you've not. He also had a good interview in USA Today. And again, where is the CDC? Why aren't they on the podium? Do we even know who the CDC director is right now? We know that Anthony Fauci is doing a great job of trying to get the message out there, but usually the CDC would be a key player. And we have the same problem here in Nebraska. We have some of the world's leading experts. Why aren't they at the podium? Why we have Ali Khan, who's cited nationally, James Lawler, who's the first to call it to sound the alarm. Why aren't they at the podium? And so I think we need to start getting some things out there and bringing the experts and getting them more involved. And so basically Tom has produced this map, and I think this is a good playbook we should start using. There's a good chance that we actually may have skipped this whole spike. So if we can keep it down here and our numbers aren't too bad, we could start talking about opening things up again. But to do that, we have to have a very rapid response where we could be, as Tom says, in this for the long haul for 9 to 18 months. There's a chance that that spring could slow down the response, but it could come back this fall yet still. We need to have a very good early detection and response and a good quick response to this. That requires a good communication strategy, which is not in place quite yet. So we can also look at the playbook of others we've seen who've done it right. So South Korea and Japan and Singapore, they were actually able to stop the epidemic without closing their businesses down. But they had an early response system that we did not. And so if we want to start opening our businesses, which we really need to do for our economy, we need to have this put in place. So again, if you haven't read or watched the TED Talk, watch Larry Bryant's talk, because he talks about how important early identification and early response are. And so hopefully we'll have the drive up testing. I think we're about 1 to 2 weeks away from this still in Lincoln yet. There's still not a lot of coordination with it, which I hope will start happening soon. To do this right, like I said, we need communication and everybody at the table. So the next thing is I think we need to start developing our community response and frankly even our state response. So what we need to have happen in the community, we need the public health department and the physician networks getting together and start creating a communication strategy and a plan on how we're going to make sure this happens, because if we start opening things up again when we have 1 to 2 cases, the word needs to get out quickly. I think you need to bring all these folks together, which we still need to do. I think the same is true of the state. There actually is a group called the Align Group that Dr. Khan has been convening at the College of Public Health. It involves the chief medical officers of all the accountable care organizations in Nebraska. Why don't we pull that community and start together and start having a statewide response to this? So hopefully that'll happen in the next week or two. Lastly, let's go into the individual stuff again. So you all hopefully know the simple rules of NPIs. If you're sick, stay home. And then the social distancing. We've got things closed down next to social distancing. Still, one of my favorite visuals is this one, where you can graphically see, here's how exponential spread works, but it looks how just individual responses can make a difference. So as you as an individual, if you would basically, make sure you wash your hands, stay home and work from home if you can. Don't go to that barbecue and birthday just because you want to, because you could be the difference between, nobody getting infected and hundreds of getting infected because of just one decision back here. So keep that in mind. Another thing is do not go to your doctor just to get tested. We do not have adequate testing supplies, and before you go to the doctor, they need to be prepared. We've had people walking in because they think they want to get tested. Do not do that. The reason being is one is if you're not severe, we don't need to test you. We need to save that test for somebody who really needs it. The second, if you're in fact actually infected and they weren't prepared, you may have just killed the little lady sitting next to you in the waiting room. You may have infected the receptionist, the nurse, and the doctor who checked you in because you didn't tell them ahead of time. So don't show up unless you were asked to show up. Remember, 80% of people with coronavirus will have mild infections and don't need any treatment. They can just rest and stay hydrated and stay at home. Keep in mind the symptoms: fever, cough, shortness of breath, sore throat. So unlike a typical cold, which may have more upper, like runny nose, sneezing, things like that, that's not typical of coronavirus. Also, things like a strep throat typically doesn't have a cough, so if you have a cough, that's less likely. So those are the symptoms. If you think you're sick with coronavirus, call your primary care clinic so they can be prepared. They can evaluate you over the phone and maybe even in the parking lot before you infect anybody else and help you get to the right place that you need to be. Again, you need to help protect these ladies. They're working hard. They're putting themselves and their own families at risk. So make sure you follow these directions and do the right thing by them because they want to do the right thing by you. A couple things that are a little annoying to me is some of the falsities out there. There was one sporadic small report out of France saying maybe chloroquine hydroxychloroquine would work. I think that's very unlikely. That's a treatment for a parasite, not a virus. And we already have a death for someone who took chloroquine without unsupervised, and actually the chloroquine killed them. So don't go running and buying chloroquine without this. I think this is very preliminary and highly unlikely to work. Maybe I'm wrong, but I think it's unlikely. Vaccine timeline, we're really looking at 12 to 18 months probably. There's a chance it could be faster, but not very likely. There are some antivirals, but they're being studied right now. It'll be a ways off. The most interesting thing, actually, on the Public Health on Call podcast out of Johns Hopkins, which if you want the up-to-date information, they produce these dailies. These are really interesting. An old treatment called convalescent serum, basically. And what happened is when somebody, back before the days of vaccines and antibiotics, they would find someone who survived an infection like for measles, they would actually draw serum from that person and then give that serum, which had the antibodies to the infection, to somebody else as a way to prevent and or treat. And so this might actually be working. So they're going to be doing studies of this. So this may be something that actually is a treatment potentially doable within months, probably faster than any of these three might. Hopefully, the ultimate treatment is vaccines, but like I say, we're a ways off from that. And lastly, of course, adjust to the new normal. My kids, they seem to be adjusting pretty well, actually. They've grown up in a world that they've never not known computers, whereas us older folks this is a little different for us. Maggie's pretty happy. I think a friend of mine said that her dog seems to be confused as to why she's home so much. I got a kick out of this post. We're all figuring out Zoom meetings and with mostly good results. It's actually been kind of entertaining at times. You see everybody laughing here in this one. This was posted by my cousin Allison this morning, and I think she's a teacher now at home from a special ed, worth trying to teach her own kids, but I kind of get a kick out of this because we've all probably seen a lot of these too. The other interesting idea was actually my father-in-law and some of his friends. They're doing Zoom virtual happy hour. Well, I'll try that out tonight because they want me to talk to them about the virus. There's some retired physicians and university folks. Zoom virtual happy hour may be a fun thing where we can connect to friends and family, not in just community, but across the country, even across the world. So anyway, hopefully this is helpful to you all. I'll keep doing these updates if people think they're helpful. This is just kind of amusing as someone who works in combination of health system, public health, and school board, but this coronavirus affects everybody.